Thank you for choosing this clinic to discuss your snoring and/or sleep apnea problem. For over 8 years, Mr. Strong has been successfully treating snoring and sleep apnea patients with a dental appliance called the SUAD device. Before your consultation can begin, we invite you to watch the following CTV video. This short video will discuss snoring, sleep apnea, and the 3 most common ways of treatment. After the video has finished, Mr. Strong or one of his associates will come in and discuss your individual concerns, answer all your questions, and show you exactly what the SUAD device looks like and how simple it is to be fitted with one.
There is an old saying, if you laugh, the world laughs with you. If you snore, you sleep alone. Well, tonight, CTV's Avis Favre reports on a medical discovery that may quiet the night.
Across the land, sleep comes. But for some, there is no rest. As a nighttime symphony begins. You wouldn't know to look at her, but Agatha Appleton was a champion snorer.
Well, I was always embarrassed about it. Always.
Snoring that was so severe it left her exhausted, even after a full night's sleep.
I would always want to sleep. That was all that was on my mind. Sleep, sleep, sleep.
Her snoring caused her to stop breathing, as you can hear in this video from a sleep lab study. Then she would waken gasping for air. It's called sleep apnea, and it worried her husband, Jim.
She would actually gag, choke, like somebody was choking her at night, and it would wake her up. She would jump up out of her sleep, and I would have to ask her if she was okay.
Doctors found that Agatha stopped breathing 89 times an hour. As a result, her brain was deprived of oxygen, her body dangerously tired.
I would be driving and I would, literally, my head would gnaw away. If I was at a stoplight, I could fall asleep. It was getting that bad.
By some estimates, almost half of the adult Canadian population snores. And about 10% of those also have sleep apnea, making it a big problem because it can be hazardous to your health. Those with apnea are at a higher risk of having heart attacks and strokes and of being in car accidents.
Never ceases to amaze me that people are alive at the end of the night, or that they don't die from oxygen deprivation.
Dr. Victor Hofstein is a leading sleep researcher at St. Michael's Hospital in Toronto.
Their oxygen drops to levels that are incompatible with life, but it doesn't stay a long time at those levels. And that is why, perhaps, people get through the night as well as they do.
When people snore, the tissue at the back of the throat, the uvula and soft palate vibrate. In apnea patients, the tissue's so loose it actually collapses in the throat, blocking oxygen flow. Not only is it tough on the body, apnea can put a strain on the strongest of marriages.
If you have a good hot rod engine that really rumbles, that's exactly what he sounded like.
Robert and Marianne Haas have been married 34 years, all of which Robert snored.
I would get angry, yes, because I couldn't get to sleep, and that would make me angry. And I knew it was unreasonable.
She was up many nights poking Robert awake when he stopped breathing, something his doctor found he did 36 times an hour.
You die 36 times an hour with this sleep apnea.
Over the years, people have tried a number of gimmicks, including nasal devices and even electric monitors, usually with minimal effect. Surgery has become another popular option. Doctors remove some of the excess tissue at the back of the throat. While it works with snorers, surgery does not work well for apnea.
I guess these are finally dry.
No need to tell that to Mary McPhee. She too snored and had apnea and tried laser surgery hoping for a cure.
I was really disappointed.
How much did you spend?
$1,200.
And the surgery didn't work?
And it didn't work.
In fact, more than half of the patients who have surgery end up with the same sleeping problems. Then there's this treatment, a machine known as CPAP, short for continuous positive airway pressure.
It's a vacuum cleaner in reverse, right? Instead of sucking air, it blows air, and it basically just splints the back of the throat open.
And it works in most snoring and apnea patients, but half don't continue using it. Not everyone, it seems, wants to sound like Darth Vader every night.
When CPAP was presented to me, it was presented as the only option for the rest of my life.
Godfrey Wild has been using CPAP for 4 years, but he doesn't want to be chained to a machine, which is why he's going to a sleep clinic to test something new.
Make yourself comfortable here in your room.
It's a dental device that keeps the throat from collapsing, a device some hope will replace both surgery and CPAP for many patients.
We'll be keeping an eye on you throughout the night.
Studies are suggesting that the appliances help to reduce snoring and mild to moderate apnea, restoring normal sleep.
This is a new area, and we're getting new results.
And it's dentists like Jeffrey Pantzer fueling the new interest in these potentially simple treatments.
Open for a sec.
Many because of their own problems with snoring and apnea.
And I noticed when I made the snoring sound, I'll demonstrate. I went like that. That's my snoring sound. And when I did that, I tried moving my jaw around to see how it worked. And I noticed when I moved my jaw forward, it reduced. So I go.
He devised a plate with an acrylic bar to push his jaw forward as he slept.
I put that appliance in that night, and that night my wife didn't sleep. She thought I was dead. It was so quiet in the house.
He now custom makes a device for patients and is working with a second device designed by a colleague in the U.S.
Just want to check it for fit.
This one was developed by Wayne Holstrom, a dentist in Vancouver, after his third brush with death.
I went to sleep at the wheel. I had had 2 previous car accidents where I had been dozing as I was driving, and this one particularly just about got me.
Diagnosed with apnea, he created a 2-part adjustable device to keep his airway open.
Dental appliance therapy is attractive to the patient and to the practicing healthcare professionals because it's non-invasive and it's reversible. Nothing bad going to happen to you here. We can move that lower jaw forward, and if we can stop the problem there, then we can deliver non-invasive reversible therapy.
And Dr. Alan Lowe, a professor of orthodontics at the University of British Columbia, has an appliance considered so promising, the federal government is funding studies of its effectiveness.
It's very exciting for a dentist to suddenly be helping save people's lives. Placing an oral appliance can change someone's response instantly within a night, from being sleep deprived chronically over a long time period to being fairly well rested the next morning.
How well do these appliances work?
The 2 o'clock patient.
It's clinics like this one at the Health Sciences Centre in London, Ontario, that are evaluating the role and effectiveness of some of the new units.
So potentially it's thousands and thousands of people out there who might find this a good treatment option for them.
Dr. Kathleen Ferguson is the lead investigator.
So if you have a dental appliance and your chances are 7 out of 10 that it's going to work, 70% success rate, and it's not surgical, it's not invasive. How are things going?
So after Mary McPhee's laser surgery failed, Dr. Ferguson suggested she try a dental appliance.
We have the results of your final sleep study, and it shows that you don't have any more apnea, and your sleep quality was much better in the lab.
My son, he said, Mom, you're not even making any noise at all.
The weather's going to be fantastic Saturday and Sunday.
Robert Haas has also been using an oral device. His last sleep study showed it eliminated his snoring and moderately reduced his apnea.
It's fantastic. I don't know. How does it work?
It works very well. He has a very small snore, if I can put it that way.
Remember Godfrey Wild? He was trying out an appliance to replace his CPAP machine. And it reduced his apnea from severe to mild.
Oh, did I?
And then there's Agatha Appleton.
I just started getting her.
With her severe apnea, doctors told her she would need surgery or at least CPAP for the rest of her life. She rejected both options in favor of a dental device.
Amazing. I don't move in the bed because I'm not gasping for air where I'm jumping back and forth. I don't toss and turn. I'm sleeping.
Tests showed her apnea went from 89 wakings an hour to none.
This is one isolated case, but this is an unbelievably good result. It's a cure, as long as she uses the device.
So there's hope yet for those who find no rest at night, that this will give way to this.